Aloha, I'm Ryan Kalesuji, joined by Yanji Denise. This is Spotlight Hawaii. Thanks so much. It's great to see so many of you already tuning in here on this Wednesday morning. And Yanji, we continue on in our conversation here on Spotlight Hawaii as we highlight some of the newsmakers, policymakers, and talk about topics that are impacting our community. Yet again, we'll be talking and focusing on COVID-19, specifically about the vaccine, and someone who's been sort of given the reins to sort of help to distribute the vaccine and to lay out that plan.
That's right. Lieutenant Governor Josh Green is joining us this morning. We know that there are so many questions about the vaccine rollout. This is such a moment of hope for our community and really for the world when we see people starting to get the vaccinations. So what does it mean for all of us? How many doses is Hawaii receiving, and how is it all coming together? Dr. Green is joining us from his office at the Capitol. Good morning, Lieutenant Governor. Tell us, we saw those first 5 inoculations at Queens yesterday. How's the rollout going, and how many more are we expecting?
Well, thank you for having me. It is exciting. It does bring hope, and it's going well. Yesterday was just a little test run so that we could see the processes that we're going to begin at Queens. Queens are our stars, so are Hawaii Pacific Health, all of the hospital systems, Castle. So Queens got the first batch, which was 975 actual doses in a bunch of little vials, which you got to see, obviously, on the TV. It was amazing. And so today they'll be vaccinating quite a lot of people, and tomorrow. It is a great, big, heavy lift to vaccinate people because you can only do so many per hour. No matter how many volunteers you have to go steadily and carefully through. But they're going now. Today, 4 additional trays will arrive. So those will go to Kaiser, Kapiolani, Straub, and Queens West. So again, let's for argument's sake, about 1,000 per tray, 975, right? So now we'll have 5,000 doses in circulation for our 1A category, and we'll break all those out for everybody again. And then next week, we expect to get a lot of vaccine. It looks like in the next 7 to 14 days, we'll get about 23 additional trays. So you see how the thousands and thousands of vaccines open up. Just in this month alone, giving you a big picture, before the end of December, we will receive 47 trays from Pfizer. So that's 47 times just under 1,000. So about 47,000 doses. And then there'll be the Moderna doses also, where we hope to get 26,000 doses. So these things are going to be very available. As long as people are somewhat patient, we will get the 1A category done, and then we'll begin to move into the other categories. So expect to see this roll out a little slowly in the first few days and then get really ramped up in week 2, 3, and 4.
And so after the frontline workers, and we know that the elderly, the kupuna, will be taken care of next, what does that rollout then look like for the general public in terms of categorizing who then gets qualified, and how will people know when it is their turn to get the vaccine?
Excellent questions. May I finish, Ryan, that first part, because you brought up a good point that I failed to mention. The long-term care, so the 1A, like you said, is frontline workers, healthcare workers, right? The healthcare system workers. And also in 1A is, like you said, the long-term care patients, our kupuna, who live in long-term care facilities who are very high risk. And those are also going to be vaccinated here in 1A. The Moderna vaccine will be predominantly used for those individuals through Walgreens and CVS, who have the federal contract. So, okay, after that is well underway, 3 weeks for the Pfizer and 4 weeks later for the Moderna, they'll get their second shot. So the 1A will take about 6 weeks to complete, maybe 8 weeks, depending on when all these vaccinations come. Meanwhile, when do other people get vaccinated, you ask? And that's in, 2A. Let's go into phase 2, okay? So you got phase 1, which is the 1A as described. 1B is people who are essential workers. And there's a big, broad category with a lot of details. That's other thousands of doses. And then 1C is our kupuna, who are healthy, otherwise at home, over 65 is the definition. So thousands and thousands of vaccines will be going out into phase 1. But what if you're just a healthy person, not too sick at all? You're a little bit farther down, a couple months down the road. First, we'll do 1A, then we'll do category 2, which is people in general with chronic disease. Like, let's say maybe your dad has high blood pressure and diabetes. He would be a classic, he's 57 years old, he would be a classic phase 2 person. He'll be contacted by his doctor, and we'll have lots of availability in We expect community clinics, vaccination centers, and so on. Tons of communication so people can sign up. And then, so that's like about 2-3 months from now where all that category gets vaccinated. And then the last category, which is people who are totally young, healthy, maybe, I hate to say this, but you two guys, I don't think you have any significant health problems, very young. And, you know, we want to get everyone vaccinated in a time based on risk. So, of course, I can't look at someone, Ryan. Many people may have a lot of health problems. They're not visible. But if you're healthy, 35 years old, you don't have any worries, you'll be in phase 3. And that's when just thousands and thousands of remaining people get the vaccine, probably late spring. Kids will come last because right now they're finishing the studies and they're at the very lowest risk category.
We've got some questions coming in at 10:34. Ryan Lokilani Kaholo says, any information or data regarding the oh no, sorry, not that one. The one before the one right below it. Daphne Rice, Lieutenant Governor Green, do you have any feelings about the Moderna versus Pfizer vaccines, differences, effectiveness? Do we get a choice as to which one we get, and how do you determine who gets what?
We do get a choice. Right now, the way it's breaking out just in the first dosages is that mostly the Moderna is being used for the long-term care facilities as part of the 1A category, and Pfizer, which was first, is going straight to the hospitals. My recommendation to facilities or people out there right now is I wouldn't worry about one versus the other. They have essentially the same side effect profile, which is pretty minimal. Some ache in the arm on the first shot, and then fatigue and some muscle aches or joint aches from the second shot. Those have been the major side effects, usually handled very well by Tylenol or ibuprofen, basic over-the-counter medications. If you get a choice, take what's available that day, in my opinion. The only real substantive difference is you got to wait 4 weeks to get your second shot from the Moderna and 3 weeks from the Pfizer. So even then, I would say take the Pfizer if it's right in front of you, because I would personally like to get it over with, be vaccinated, and stop worrying about all of the potential for infection. I've begun to draft a memo, which I will get over to the governor and the other leadership today, which will hopefully spell out ways to get out of the travel quarantines if you've been fully vaccinated. I know that that's on people's mind. So take what you can get, and then I'll give update information as I learn about the third and the fourth and the fifth vaccinations. Some of them might just be one shot, which would be awfully convenient. But so far, we don't have a lot of details.
And so to expand upon that, these vaccines that are requiring the second shot, I mean, logistically, how does that get managed as well? Do the people that get that first vaccine and that first shot then immediately get scheduled for the second shot? And what does that sort of logistically look like while trying to provide the second shot as well as vaccinate those who have not yet received their first shot?
Yeah, that's the large logistic lift, right? So what we're seeing right now is that we will give people a paper copy, kind of the old school, which is their yellow card that says you were vaccinated on December 15th and you received your first shot. It was the Pfizer dose. Please come back on or after, and then 21 days later. So in that case, it would be like, the 6th of January. You can go later. You can't go earlier. That's an important point I think I should make. We also will have a digital way to text people and email them as well. There's a system called the VAMS system, which is vaccine. It's a vaccine administrative mechanism system, but it has had an occasional glitch, and we don't want to promote anything that exposes anybody's personal information or personal health information. So right now we're going to be very careful. For phase 1A at the hospital level, all of these workers are in the electronic medical record of Queens or Hawaii Pacific Health, so they can very easily send you a reminder. That's why 1A is a kind of an easier program than ultimately when we get to phase 2 and 3, which is out to our community at large. By then, we want to have a perfected system, and I'm meeting with lots of people. We're going to talk to Oracle. We're talking, of course, to these folks from the federal government, the VAMS program. There have been a few other people that reached out to us, and we want it to be really simple. This one is one we have to try not to mess up at all.
Okay, Bob's got a question at 10:39. Big Island status. Waimea facility, Queens Hospital, Kapuna with autoimmune diseases. When can I receive the vaccine? Not just for Bob, but for those people who do live in more rural communities. We know that, a lot of neighbor island folks have to drive 1 or 2 hours to get to a hospital. And given the refrigeration requirements of the vaccine, what does the rollout look like for the more remote communities?
Great question. So they will receive their vaccine trays next week, the first batches of them. That's that set of the next 23 batches. Many of those are going to Kona Hospital, North Hawaii Community Hospital, Maui Memorial Hospital, over on Kauai. All of the places all across the state start getting their vaccine trays. Some people ask the question, why did those first 5 trays all go to Oahu? It was purely based on the pre-order and the refrigeration capacity. That was it. It was not specific to anything else. We had to make sure that people had already well established in advance, assured, very low temperature freezers. Otherwise, the vaccine becomes, as you know, useless. So it's next week. It'll stay with the same tiered system. I'll say it again really, but very quickly. 1A is healthcare workers and kupuna at nursing facilities. 1B is essential workers stratified by exposure. More details to come. 1C is straight kapuna over 65. And a lot of people will fall into a couple of those categories. Then phase 2 is anybody with chronic disease. They will definitely at each facility make a kind of judgment call if someone makes an appeal for a specific immunization, if they're already essentially in an extreme circumstance, but we'll try to stick as close to these categories as we can, because otherwise we could see a rush, and we don't want to disrupt the overall master plan. The master plan is meant to decrease risk for all.
We have some other questions that are coming in. Stephanie's asking about how long will the vaccine be effective for? Is it something that will have to be taken each year like the flu shot? And Terry, to this point, a similar question asking, will the vaccines prevent infection even with new mutations of the virus? Can you speak to the effectiveness of the vaccine, the length of time, and how often people will have to end up getting this?
You bet. We expect it to last no less than a year. They will be doing studies constantly on those of us who have all been vaccinated or have chosen. Remember, it is a totally voluntary process. If people don't want to be vaccinated, they do not need to be vaccinated, at least based on anything I am saying or the state is saying. We'll talk a little bit more about that in a second. But it should be a year, maybe longer. I listened to the gentleman who is the PhD lead for the Pfizer vaccine. He thinks it might be as long as 2 years based on what he's seen, but we'll actually check that with the analytics and then know. Keep in mind that flu vaccines, because of mutations, have been year over year. And that speaks to the second part of this question, to try to get the right flu vaccine for the right strains. But the Pneumovax, the pneumonia vaccine is every 10 years. And it's been really protective for people with a 10-year shot. So it's going to be somewhere in between there. We'll know the data by fall because millions of people are getting vaccinated and then subsequently studied who actually end up catching it. They're not 100% reliable. They're about 95% reliable.
Alakai Moaniala at 1041 says, no mask, no entry, no vaccine, no entry. Do you anticipate a time, you referenced it a minute ago talking about travelers, do you anticipate a system where the state could say, okay, travelers, you have to have a vaccine to enter the state of Hawaii?
I don't anticipate that, no. I think it will, though, count against the rules. If you have your vaccine completed, I do not think you should have to go through the pre-travel tests. And my proposal would be that starting February 1st, and we'll let the Department of Health make the final decisions, of course, with the governor, but it just stands to reason that based on very good results from the vaccination trials, if you're vaccinated and you're immune, you shouldn't have to go through the extra trouble of getting the test. Same thing would certainly apply for our inter-county travel, inter-island travel. Again, if you've completed the vaccination process and therefore are immune, you shouldn't have to go and get pre-tests. It's not 100% guaranteed, but the likelihood of infection is so low that I don't see the reasons to put people through that. Plus, from my perspective, it adds an extra incentive, and I'm pro-vaccination as long as it's done safely and with good research. It gives an extra incentive to people to get it if they benefit not just from not catching COVID, but from not worrying about many other rules. I am certain we will get something like that into our policy, but it's a little ways off because nobody's going to get their second shot for at least 3 weeks. I mean, people, I guess there are 5 people who got it yesterday, right? Those 5 people, 3 weeks from yesterday, got their second shot. First shot gives 52% immunity from catching COVID. The second shot takes you to 95 or 94.5%, depending which vaccine. Some of the subsequent studies have shown one of the other vaccines that's being considered is 70%, but I think it was only 1 shot. So there'll be lots of choices for people to make. This overall is going to ratchet down case counts, risk, and so on, but the world will start opening up again. People will be back to work and travel. So it's going to be kind of a tug of war with the virus in 2021, but we're going to win this tug of war because we got a vaccine, we're smart, we're masking, and we got safe travels.
Let's continue to talk about the Safe Travels program, as we know that there has continued to be new plans and new requests that have come in from different mayors. You know, we've spoken to Mayor Kawakami, who continues to wait to see if the governor will allow him to do that follow-up third testing so that he can lift that 10-day quarantine period. We also know that you also propose extending the time of 72 hours to including more time so people can get their tests and results in hand. Can you sort of give us an update on any of the progress that's being made with some of these new recommendations, and if we can see any changes anytime soon for the Safe Travels program?
Sure. Respect all of the mayors and their proposals. I'm not saying that glibly. I really do. And of course, I'm high on my own proposals, but I think the governor is going to stay the course through the holidays. The system has demonstrated the ability to keep our case counts very low. Each week over week, more and more people are familiar that we're not kidding around when we talk about you have to have your test in hand before you travel, and there's nothing to prevent the other counties from doing additional testing if they want to. So the system is kind of normalized internally, and every time we make a change, it freaks out the mainland and travel companies and everything. So I think that's where the governor is right now. He wants to get through the holidays, and that would mean Christmas and New Year's, till we look at any other changes. Meanwhile, we're refining a lot of the kind of the innards of our system, getting the computer working better constantly on our trusted partners, making our trusted partners help us more. You saw a lot of reports that the airlines are now doing they're wrapping a bow around it. They're getting everybody checked and uploaded before they travel. That was on Alaskan Airlines, I believe. I'm sure others will follow suit. So there's incremental changes for the better with the rules we have right now. And sometimes those of us who would like to isolate a challenge and see that fixed, sometimes it's just too much for the system to bear. And I think that's why the governor is just sticking with what's going on. But I do think that after the New Year's, we'll refine things a little bit once travel dies down, so it's not as disruptive.
I want to go back to 1031, Ryan. This question from Kenneth Takeue says, even if you get the vaccine, aren't you supposed to continue wearing masks to prevent you from spreading the virus if you have it? So what is the protocol? Let's say you've gotten your 2 shots, you have 95%, chance of immunity. What does that mean for mask mandates going forward?
We'll keep the mask mandates for some time for sure. My feeling is we should keep the mask mandate until we achieve herd immunity in our state. And there's reasons for that. For example, people who already have had COVID are very likely fully immune. I am, for example, right now filled with antibodies, and I can't catch or spread COVID, but I still wear a mask. Occasionally we all let our guard down, but still wear a mask because you want to set an example. You can also spread flu and colds, by the way, which freaks everyone out because then they think they've got COVID. So it's another thing that I can't guarantee I or someone else wouldn't give you. And I also feel it would be very difficult for us to discriminate one person from another. You won't know whether or not someone got their vaccine. They're not going to bust out their yellow card and say, look, I'm not wearing a mask because I got vaccinated. That's too confrontational. So I think it's better for us to continue with a good policy of wearing masks, safe social distancing, hand washing. We'll all benefit from that. Over time, though, you can expect us constantly to reassess the program because I know that masks are uncomfortable for some and they are difficult from a social standpoint. But we still will have a lot of COVID around for some time, and we'll certainly have a lot of risk around for some time. So let's get through the bulk of the vaccinations, And then hopefully masks will be in the rearview mirror, or they'll certainly be in our drawers until the next problem we have.
We know that, of course, there was a big push during the Thanksgiving holiday season of reminding people not to gather. Of course, Christmas is coming up, followed by New Year's, a time where many people in Hawaii like to gather around midnight with family gatherings. Are you concerned again with this next round of holidays and what this could mean for a potential spreading of this virus throughout the community?
I definitely am. I think that we did a good job over Thanksgiving. We had a small bump in cases overall, about a 15% bump maybe. And then there was, of course, the overlapping problem of having the prison, with a couple hundred cases. That actually caused an artificial bump in the number per week. And I think that the mayor was correct that number does not have to reflect on the overall circumstance. But we still did see between 90 and maybe 110 cases per day on average, coming out of not just Thanksgiving, but the Black Friday sales where a lot of people were out. So we learned that lesson and we did well. We did not see a big surge. We did not see an increase in our hospitalizations yet, of course, because it's only been 2.5 weeks since Thanksgiving. We will have to be just as disciplined through Christmas and New Year's. People should definitely plan on having quiet Christmas holiday, quiet New Year's holiday. Do not have large gatherings, especially when everyone is boozed up on New Year's. Please don't drink and drive, and please don't gather in significant groups, because the ER doc of me doesn't want to see car crashes, and the LG COVID guy does not want to see a big number of cases starting on the 10th of January, just as we're finally vaccinating a large number of people. So we'll have to be careful. It remains to be seen whether or not the mayor and mayors in general loosen their restrictions on gatherings. My overall feeling is we should be as safe as possible. Call 2020 a great success, knock wood, in Hawaii if we don't see a third surge. And then gradually, look, the new mayors are going to come in. They're going to, obviously, it's going to be their prerogative what changes they need to make. But let's start them off with a good, clean slate without a lot of cases.
Terry Onamine has a question. If you already got COVID, should you take the vaccine?
If it's been more than 90 days since you had COVID, yes. If it's less than 90 days, you probably can wait a bit because you definitely still have active immunity from your case. But we don't have very good data on if you had a very mild case of COVID, did you mount a good immune response? If you had a very heavy case of COVID, we know people got major immune responses after that. So there's just a lot of uncertainty. The overall recommendation is if you come up in your category, if you are a healthcare worker and you had COVID 3, 4, 5 months ago, get your vaccination. Do it because we don't want to see you risk that second possible infection, though rare. And we also want to be pretty streamlined in our assessment of how our system is working. So for instance, I had COVID on 9/11. It's been a little over 3 months. They've recommended that I get a shot next week. As a healthcare provider, I will go get one. And then 3 weeks later, I'll get the second shot. And I could tell you, just as a person who will then continue to do shifts, I'm on call this weekend, I'm going to feel a lot of relief that there's virtually no chance, knock wood again, that I'm going to catch COVID. But I also don't want to bring it home from the hospital to my families or to my workplaces or what have you. So those individuals who have had COVID, they're in a little bit of a gray area. But as a society, let's follow kind of singular rules unless people have some kind of philosophical opposition.
We don't have a lot of time left in this conversation, but we do want to address, of course, not only has this impacted, overall the health of our community, but also the economy as a whole. And we've heard from the governor talks of the furloughs, his proposed budget that will be heading down to the legislature for them to decide. We've seen pushback from unions such as the teachers union. What are your overall thoughts about the state's budget and the state going into the next year, having to make these decisions and these furloughs that are looming for not only teachers, but state employees?
Yeah, they hurt. Okay, let me give you a couple basic observations from just the LG, just me. I will take the pay cut in advance out of respect to the governor and the hard decisions that he has to make and to the suffering that small businesses and everyone else has done. and made. So of course I will take that cut. And I think people in similar situations as to myself, we will take it willingly and respectfully. I think, too, the best way that I can work on this is to open our economy. It's why I was really, I guess I would say, really focused on getting safe travels going and getting some of our economy going again, because it will give us an opportunity to have a pretty vibrant 2021, especially with the vaccine. The best answer to not have to have furloughs is to have some money here in Hawaii and to not have a big outbreak, which would devastate us. So that is my total focus. If you ask me, would I prefer to have 1 day instead of 2 days a month? Of course, it would hurt a lot less. I do have to defer to the governor because my role is just to advise and work on this COVID crisis right now. I definitely am like everybody else. I don't want to see cuts if we don't have to make them. If the federal government does come in with a second significant or another major appropriation, we and many of us in the cabinet, I should say, have asked the Gov to remain open-minded about being able to pull back from that position on furloughs. And he was very respectful to those of us who recommended that. So this was, in his mind, a flexible way to quickly pull back from any cuts. And I sure hope that that happens, because I don't like to see anyone suffer economically. People have suffered quite a lot this year.
We're getting a couple more questions. I know our time is limited, but I just want to get this one in because I think it's important. This is from Kelsey Klein. Says, after getting vaccinated, are you still able to spread the virus? Is vaccine shedding possible?
Vaccine shedding is not possible because it's not a live virus. It's just essentially the mRNA, which is the proteins, and your own antibodies that are responding to that, your immune system. So you can't spread anything from the vaccine. Now, you only get limited immunity from the first shot. So you could catch COVID. Still, you're about 50% susceptible. 52% immunity is acquired from the first shot, meaning you have 52% chance less to catch COVID, period. So you could catch COVID and be spreading it just like any other COVID infected individual. After the second shot, really low likelihood. But after you get your shot in the arm, there's nothing from that shot that's going to make you at risk for any transmission of anything. You're just going to have a little ache in your arm, maybe. You might have nothing, honestly. I strongly recommend getting the vaccine if people feel comfortable based on the research, they don't have a philosophical opposition to it, and especially if they are in a place in their life where they could catch it and spread it to loved ones who are even more vulnerable. That's how I feel, right? I'm just one person, but I think that over time, about 70% of our society will get it. That's about 980,000 people. And then we're going to be essentially immune as a state. But it's a lot of work. Kudos to Department of Health, HIEMA, Governor for keeping on this fight, for all of the healthcare institutions that are doing the vaccine already. It's just, I mean, it's an amazing lift. And across the country, you know, it's going to be 70% or so of 330 million people. It's the biggest public health initiative in the history of America. So if people could be patient, expect these doses to come in steadily, and then if we get a couple lucky breaks with a lot of other companies coming on board, we could get a lot of vaccine quickly in the spring. And that brings us full circle back to your earlier questions. When can regular folks get the vaccine? Sooner rather than later, in my opinion, because I think a lot of these companies are going to get approved, and we will have the apparatus ready to vaccinate.
When do you think we could actually hit that 70%, provided that people are willing to get the vaccine?
I think summertime. My personal prediction, when the kids ask me across the dinner table, when I think July 4th is a real reasonable time where we could have so many people vaccinated that we begin psychologically to think, okay, most of us are safe. Probably still should wear a mask when we're at gatherings, when we're big public places, but we will begin to put it behind us. And I think that is very possible. The good news is we're going to see week over week how many actual vaccines we received, how many we actually applied, and we'll see whether or not we have extra resistance to vaccines this time around, or whether there's a lot of extra uptake, because pretty much all anybody's been talking about for the last year.
And so is that a number that will be provided as well with sort of the counts, is the number of people that have been vaccinated? I mean, is that something that you folks will be keeping track of and making publicly known as far as who in the state and how many people have been vaccinated?
Absolutely. I think that transparency is really important. And that would include also people who have had side effects. If there have been any, serious allergic reactions, if God forbid there's any even greater consequences, if anybody got very sick or passed from the vaccine, all of that should be shared completely openly. And for my part, I will obviously give you all the data I have. I usually get it pretty much in real time. It is going to be a process, though. First, it's going to look like small numbers, and then all of a sudden, it's going to be like, wow, now 70,000 vaccines have gone into people's arms, and we'll be able to even tell you how many people showed up for the follow-up vaccine, because that's really important. One shot just won't do it. It really needs to be that pair of shots from the same company. You guys will have all that information, and I'm happy to share it on your show or in whatever venue you think would be best.
Okay, final question, because we know we're at the top of the hour. A lot of folks asking when you yourself will get the vaccine, and if you'll film that or share that with people who are frankly critical of the vaccine or have some trepidation about getting it, have expressed their interest in seeing you get it first, if you will.
Oh yeah, those dudes would like to give it to me right in the neck, right here. Look, I will definitely get the vaccine. I will make sure the guys film it. They should film the vial. It's interesting, Yunji, it cuts both ways. Like, I don't want to go before anybody else that is entitled to it, but I am a healthcare provider and I believe in vaccines personally, and I want to show out of good faith that I'm willing to take something that I would ask anyone else to take. So I'm waiting for them to schedule me. I'm told it'll be next week. There are other first responders, number one, who see more patients than I do, although I'm on call this weekend. Also, I did have the disease, so I have some limited immunity. And therefore, I didn't want to go ahead of, say, a surgeon or a critical care nurse at Queens or Hawaii Pacific Health who this weekend might see 30 patients and never had COVID. So out of fairness, yes, I'm going to just wait until they tell me, but I'm also going to totally show you guys me getting the vaccine and tell you what my experience was candidly, whether it's good or bad. So that's my commitment to you and everybody else. And I hope people will just be open-minded about it, because I think this is an important part of our societal response to COVID.
All right, Lieutenant Governor Josh Green, thank you so much for taking the time and updating us on this vaccine rollout. And we look forward to hearing from you. Actually, next year, we actually won't be seeing you before Christmas. So happy holidays to you and your family. And thanks for all the information you provided us over the past few months. And we'll see you next year.
Thank you very much. Have a great, happy, and safe holiday.
Aloha.
Thank you. Wow, Ryan. Well, I loved getting to hear some specific timetables from him, and the idea that July 4th is an Independence Day of a different sort of value coming up next summer. So that was wonderful to hear. We loved all of your questions. Thank you so much to all of you who participated in the discussion. And it was interesting to hear just, how they're going to handle the neighbor island communities, this challenge of getting people to come in for the second shot. And we're going to see this sort of exponential increase in people who have been vaccinated. But even still, they do want folks to wear a mask, and social distancing will be part of our lives for the foreseeable future.
Yeah, and also mentioning the fact that, of course, this is the Pfizer vaccine that has been the one that is being distributed, but the Moderna one also on track to potentially be approved later this week, and then thus beginning that rollout as well. And so we will beginning to see more and different types of vaccines becoming available, thus helping to sort of expedite this process through the community, but really outlining when people can expect to get these shots and vaccines is through a new tier system, if you will. If you missed that part of the conversation, we encourage you to go back and watch the earlier moments where Dr. Green shared sort of the rollout plan moving forward and when people can expect to be getting these vaccines.
Of course, he's not only in charge of the vaccine rollout, he's been in charge of the Safe Travels program, and he indicated that there will be no changes made to that program until next year. So I don't think Hawaii will be getting the request for the second testing that they've been asking for. It looks like that's not going to happen. One change that could happen, though, is people who show proof of vaccination could bypass quarantine altogether. And that would be a big step forward for a lot of the travel industry that wants to be able to see guests come and go. And that would just alleviate a lot of headache for travelers.
That's right. And we'll continue to keep a close eye on this, as well as, again, we'll be talking to the Lieutenant Governor next month for more updates on the vaccine and other updates as they become available. Joining us on Friday will be Superintendent Christina Kishimoto. Dr. Kishimoto will be joining the conversation. We know that there has been a lot of talk in the community about the proposed furloughs. Dr. Kishimoto actually releasing a memo yesterday talking about teachers and having to take 1 day off a month. And so we're going to hear from her on that plan with the implemented furlough, the pushback that the teachers union is obviously now pushing back against as well.
Yeah, and also the implications for the vaccine when it comes to teachers and in-person learning. What does it mean now that this will be available for our community? Where do teachers fall in the rollout plan, and how soon could they be vaccinated? We know that kids will be last, but teachers obviously will be getting theirs pretty soon. So what does that mean when we go back to school? So very, very much looking forward to that conversation. And then on Monday, we know a lot of you still have unemployment questions. So the head of the Department of Labor and Industrial Relations, Ann Pereira Estaquio, is going to be joining us to answer all of those questions. A lot of those benefits expiring at the end of this month. So bring your questions for her, because we know that there are plenty of you who are still waiting on benefits.
Yeah, and then a week from today, we're going to have a special conversation. Of course, we know that COVID-19 is something that has impacted us here in Hawaii, but this is a global pandemic. And so we're going to be getting the perspective of how others in other countries, as well as throughout the country, are dealing with this and what they're seeing in their communities. We're going to hear from those who are covering those stories, reporters who are stationed throughout the globe covering this pandemic and sort of highlighting how it changes from community to community in different cities. Looking forward to that conversation as well. So we thank all of you again for tuning in. A number of questions. I know that there are a lot of people questions concerning the vaccine that we hope to have been able to provide you some information through the Lieutenant Governor. We thank him for once again joining us, and we thank you always for tuning in. We'll see you right back here on Friday at 10:30 for another edition of Spotlight Hawaii. Aloha.
Aloha.